Hi, I'm Rich, and this is my CAR T-cell therapy story. When I think back to it the year before I was diagnosed, there were a lot of different cues. I was getting short of breath. I was struggling even getting to the top of the steps in a 2-story house. And so it was at that time I finally called my doctor. He said, "You have blood cancer." And then, that sits with you and hits you for a while when you get the C word. So then you start thinking about a lot of different things.
I was just very alarmed by the diagnosis, not sure how I could support him.
I was fortunate that the initial induction therapy had really helped lower my levels of cancer in my body.
We found a doctor that we felt very comfortable with. He had mentioned the CAR T-cell therapy.
It took your own T-cells from your body, which, if there wasn't something wrong, would fight the cancer off. I mean, everybody has that in their body, and the ability to take the T-cells and actually put a receptor on them that would then bind to the cancer cells and kill them. And so it was really fascinating, the research on it. The more research I did on CAR T therapy, the more hopeful I became. I just knew that this, for me, was the best option. I did get connected with other cancer patients. I found it very helpful, and talked to a specific individual that had had a cell therapy for blood cancer a month before I was going in. So that was helpful to sort of demystify this faraway thing that I didn't know anybody that had it. The process of treatment leading up to CAR T-cell therapy was to collect my T-cells. At that point, they took the cells off to manufacture and add the CAR to that chimeric antigen receptor to the cell. And then I went into the hospital. And while in the hospital, I had lymphodepleting chemotherapy. And that, again, is just making way for the T-cells to be able to do their job. And then it was infusion day. And then you go through a lot of different emotions. One is excitement, wanting the CAR T-cells to do their job. And then another is a little bit of nervousness, because like with anything, there are potential side effects. So there is a side effect that people read about called CRS, which is cytokine release syndrome. Really, it's inflammation from your body killing the cancer cells. The other thing that people have to watch out for is ICANS. The staff would come in every day, ask me the same set of questions. I didn't have any issues with my memory, didn't spike any fevers. So I felt very fortunate going through the process. I think of what joy is now, certainly more time with family and friends. Since having CAR T-cell therapy, I think it's just the appreciation for life, knowing that nothing is guaranteed, that even with this, there can be relapses for people, that you just have a better appreciation to not waste time on things that don't matter, to focus on things that do matter. And I think you just become more aware of what's happening in the world around you.